All righty. Well, we're about to go ahead and get started. We are getting relaunched, I feel like, relaunched for our Arkansas Association of Black Psychology Professionals Mindful Minute Conversation Series. All righty. We have some people joining us. And as you all are joining, I'm just going to adjust the screen so that our panelists are on the screen. But thank you all for joining as you are doing so. Okay. All righty. So with today, we're going to go ahead and get started with our September Mindful Minute Conversation Series. And so today we're going to talk about parental concerns of returning to school. And we have with us our esteemed panelists. We have Miss Regina Hunt, Dr. Karen Moore, and Miss Kimberly Lawrence. So we're just going to go ahead and jump in, and I'm just going to ask them to introduce themselves, and we're going to get started with this conversation. So Miss Regina, if you don't mind getting us started with introducing yourself.
Yes, I'm Regina Hunt. I'm a licensed psychological examiner with the State of Psychology Board in Arkansas. I currently work for Pulaski County Special School District in the position of a psychological examiner. I have the opportunity to meet a number of students and parents who are for students who are referred for special education services, but I also work in other capacities as well. And so I'll be sharing from the perspective of what I see in the schools and my interactions with parents and students, and also just a little bit about how I feel the pandemic has affected me as a provider, and things that I've been able to use to help me navigate this territory that we're in. Thank you.
All right, thank you so much. Karen.
Yes, my name is Dr. Karen Moore, and I'm a licensed psychologist in the state of Arkansas, and just recently, earlier this year, in Texas too. I am the owner of Stillwater's Consulting Group, and I'm in private practice, but I also try to have my foot over there in some of these school districts in the central Arkansas area. I must say that I'm a little biased towards Hall, Little Rock School District, because I'm a warrior. Sorry for all the other folks. Anyway, but I hope to bring a perspective of what's going on in private practice, and then also as a provider, I contract with school districts, so I see and hear things from that side as well inside the schools. And I'm super excited to be here and provide resources.
Awesome, awesome. Thank you both for joining. As I mentioned earlier, we have another panelist, Kimberly Lawrence, who's going to be joining us shortly. And when she joins, she will introduce herself. So thank you all for joining. Let me just say who I am. My name is Dr. Kyla Holmes, and I am the Vice President of the Arkansas Association of Black Psychology Professionals. And we have been doing this conversation series, I think, for a little over a year. So I'm just excited that we're able to keep this conversation going that's helping people within our community to navigate all of what's going on, the pandemic, just everything that's going on in life right now. It's a lot going on for people. So we just want to be able to provide these practical tools, this conversation, these resources that can help people just have ways of navigating it. So hopefully they can enjoy more days than not. So, well, our specific conversation again today is about parents and what parents are dealing with. So we know that right now, school just started here for us in Arkansas, about a month ago, kind of depending on what school people go to. It started about a month ago, a little bit longer for other kiddos. So, of course, these panelists are here today because just like they said, they work with children, they work in the schools, they see what's going on. So if you all don't mind, let's just start with what you all are seeing. What are some of the challenges, almost like the unique challenges that you see parents and our families facing, particularly in the last month or so? What are some of those challenges, those stressors?
I can speak from actually the parent and the child side. I see the children are kind of anxious about going back, though they're excited because for those that never transitioned back into the schools last year, that they are looking forward to maybe seeing their friends. But also you have to keep in mind that everybody's going back at the same time. So where there were a small amount of people who transitioned back into the schools, it wasn't at full capacity. So at some of these schools where you go from maybe 1,000 to 1,500 to almost 2,500. So I've heard recently students in a large building. I hear some of the high school students at the personally tell me how they are pushing and shoving because there's so many people, and then some people are wearing masks, some people aren't. And I think parents in general are just maybe on edge, making sure that that their kids are doing what they have asked them to do, whether it's wear a mask or whatever or not. But what about everybody else? What are they doing? Also, I think the families are being impacted by the shortage of teachers too, especially in the education area. There's a large number of open positions across a number of districts at this time that are significantly impacting services. And so parents are struggling with how to support their kids as well. So all of that that's just dealing with children in school, not to mention the moratorium has been lifted. And so the rent moratorium, where the eviction moratorium rather. And so that has expired. And then, so I guess they're back to the business of evictions, and people are struggling with finding places to live and paying bills that are now due. And it's just, I think it's kind of a complex, compounded stressors that, maybe one here or there. Now everything is just coming at one time, and it's overwhelming parents.
I think this, Regina, I think what I've seen even before school started was that struggle for parents to make a determination about whether or not I want my child to go to school in person or whether I want them to be on the virtual platform. So Pulaski County made the decision to offer a virtual platform for students it's called the Driven Virtual Academy, and it is a separate school from traditional school. So if you're in the Driven Virtual Academy, then that's where you receive all of your instruction, and they also are mandated to provide the special education services to ensure that children are receiving those extra supports that they need, as well as 504 accommodations. What I've seen in my, so I don't see those students unless I have to do an evaluation, and thus far I haven't. But what I've seen in students and parents who are in the traditional setting is I see students who are excited about being back in school with their friends, but also with that comes a lot of anxiety about, am I going to be safe? What if I get sick? What happens? And we've had some classrooms in a couple of classrooms who've had to go virtual due to exposure. And that made some of the students very anxious, also made their parents very anxious. And as Dr. Moore said, parents are dealing with so many stresses on so many levels. Parents, we always have some of those students who are in need of assistance, like for school uniforms and just all kinds of things that they need in terms of preparing for school or having the things that they need. And so the two schools that I work at, and for the most part across the district, we do have some supports for parents to get uniforms. That's a stressor that they can take off of their plate. But as Dr. Moore was talking about also is the financial part. As parents realize that many of the benefits that they received during the early months of the pandemic, such as the child tax credit payments that they received, and they received a lot of support. And now those things are phasing out, and some of our parents are really distressed about how we're going to meet those needs, even though many of them are working. You know, even when they were working, they were not making a living wage, several parents. And so that's another stressor for them. If they themselves have issues with any type of mental health problems or concerns, those are at a heightened level at this time. And so one of the things that we want to do today is to share some resources with them that'll come towards the end of how resources within the community that they can access to get assistance where needed. I think one of the biggest challenges for parents is navigating their own emotional stress and making sure that their kids are emotionally secure as well. And so we want to talk a little bit about what type of signs and symptoms do we see in students, particularly those who are dealing with anxiety. And I think last year we had records number of children who were being seen for anxiety and depression. And I work mainly with elementary students, and it was really disheartening to me to see so many students anxious and just ready to check out. You know, it was like too much.
Yeah.
And so Kim is on now, so I want to give her some time. I don't want to hog all the time.
Yeah, thank you so much. Thank you so much, Ms. Hunt. If I could just maybe just recap a little bit of what you all said, because you all have already dropped some nuggets, and then I definitely want to Kimberly Lawrence to introduce herself, but I just want to highlight some nuggets you all said. I feel like both of you all focus on really I think Dr. Moore, you mentioned the compounded stressors, the complexity of stressors that families are experiencing right now. And part of it seems to be with the timing. So school started back at around the same time that supports were phasing out. So not only are parents dealing with making a decision about virtual, in-person homeschooling, what do I want to do, their child's social needs, but they're also dealing with just getting their basic practical needs met. Do I feel secure in putting food on the table and having a place to live and being able to make sure they have their uniforms or their clothes? So I appreciate you guys introducing that is layers, multiple complex stressors that families are dealing with right now, right as school is starting. So I appreciate that. And we're definitely going to shift over to the signs and symptoms and resources. But yes, Kimberly Lawrence, you're on. If you don't mind just introducing yourself for those that have joined us today.
Good evening. I am Kim Lawrence. I am a licensed psychological examiner, and I as well work in the school district. I'm currently working for the Little Rock School District, and I am based out of Central High School and Forest Heights, K-8 STEM Academy. So I get to see from kindergarten through 12th grade, just some of the challenges and stressors and things like that that's going on, with the pandemic and returning to school and things like that. I've been in education. I'm in the education sector now for about 9 years. And so it's interesting. I have my foot in a little bit of clinical as well. So I too get to kind of see both sides and get a parent's perspective as well as what educators are dealing with and students. So, and I'm happy to be on.
Okay, wonderful. Thank you so much for joining. We have multiple perspectives that could be spoken to today, the children, the parents, educators, and then Ms. Hunt, you mentioned earlier from even a provider standpoint. You mentioned about signs and symptoms. So you all have used words like anxiety, depression, and stress, and being on edge. Those are a lot of different emotions. And out of that, all of those emotions are going on among all these kids and parents and educators all at once, right? If you all could speak to what does that look like? Like, how would a parent or even an educator know that a child, and if somebody could speak to the little ones, like elementary age and then middle school, high school, what would that kind of look like if somebody is struggling with anxiety and depression or significant stress or something?
Well, I can speak to, particularly since I work mainly with elementary and early childhood students, what I've seen is a lot of irritability. They're restless. I see meltdowns. What I mean by meltdowns is like uncontrollable emotions, crying, just getting upset about very small things that we would think it's a small thing, but to the students, to the children, it's a big thing. And so the added stressor there for the parent is you have the school calling you several times a week saying, you know, Johnny is out of control. We need to do something with him or whatever we, you know, because he's disrupting the learning environment for himself as well as other students. And while we have those issues with children, and you also have educators who are on edge as well, because they're having to deal with this type of behavior in a classroom where they may not have the skills or to be able to deal with that. You know, I can not call in any names, but I had a student who has never been to school before. This was the first entry to school. His kindergarten was kindergarten. And so when he was having to like adjust to the routine of the school and trying to get an understanding of what it means to be in a community, a learning community with his peers and with someone in charge and order and structure in his day, if he's not had that level of structure, that just created a lot of anxiety and stress for him. And also for his parents, because they're getting calls and they're not really sure what to do with him as well. And we were able to facilitate them gaining some resources and services within the community. I'm not a therapist in the school setting, but people know that I have a mental health background. And so they often ask me, you know, what are some suggestions that you have for us?
So let me just clarify, Ms. Hunt. So are you saying that with the behavior sometimes that you see in the young children, that oftentimes it's a reason for it, that either he was adjusting, it was anxiety, it was stress, and that led to the behavior that you all saw in the teacher cell?
Exactly. I think that's it. And so sometimes we tend to, adults tend to interpret students' behavior, and they have perceptions of certain groups of people or students, and it actually serves to be counterproductive, to be able to ascribe a title or a label or something for behavior that you don't completely understand. And so that's where, like, I don't know if Kim is able to do that in her schools. I try to help clarify that for them, what I think is driving the behavior, and try to pursue assistance for them based on that.
Yeah, that's key. I want to be sure our listeners hear that. So you're saying understand the behavior. Understand the behavior. What's driving the train of the behavior? I think that's great. That's already a good tip there. Understand it.
Right. And I think that's for parents as well, you know, because they get frustrated. Parents are like, you know, maybe they're on edge about how we're going to get all of the things done that we need to get done within the course of a day, or provide this or that. And so they're stressed. And a lot of times, you know, on the surface, it looks like they're handling it, but inside, you know, they are really distressed. And sometimes all it takes is to say, okay, is there anything else that we can help you with? Or are there other concerns that you'd like to bring to the committee today? And I think it really helps when parents hear that you're not just there to pounce on their child, but you're really taking an interest in how to help them help their child and help the school provide for their child as well.
That's awesome. Everybody working together. Dr. Moore or Kimberly, yeah, go ahead. Dr. Moore, you're about to say, go ahead. Yeah.
Yes. And on the flip side of that, even that example, I have personally worked with kids, because you know there's all different types of kids, say, in that classroom, where that one child may not have had previous experience in being in a structured environment. So it may impact other kids. And that has come up where they're anxious, or their feelings are hurt because they feel like this particular kid is bullying them or things like that. What I do is we try to dig a little deeper. So we act as detectives and figure out what could be driving this behavior. So just introducing a different perspective. And then also, I'm all about grace. I said, you know what, this particular kid told me, like, this is their first time in a classroom. So somebody's talking to them, which is great. I said, so if you're new to something, shouldn't you get a little bit more time to get adjusted? So let's give this kiddo a little bit more grace and not think that they are purposely out to get you, right? So maybe you can model how to be a good friend. So changing the way they perceive and approach situations like that. That's what I've also been working on too.
Yeah, I think that that's great. And what I just want to highlight in what you all are saying is I feel like what part of you all are talking about are some of the stressors that happen when kids start school for the first time anyway, right? So this goes back to the layers of stress that parents are dealing with, because I'd imagine the parents of the kiddo having the difficulty adjusting and the other kids in the classroom, those are just the standard difficulties with just starting school in kindergarten for the first time, right? Especially if they didn't go to pre-K or Head Start. But now we have the pandemic on top of that. So this just kind of goes back to the layers of challenges that parents are dealing with. So Kim, our conversation, if you could add to the conversation, particularly you mentioned like a high school setting, what are the signs and symptoms of high school students who are struggling with stress or depression and anxiety? What does that look like?
Well, and I would say they're struggling with a little more than that.
Okay, a little more than that. Okay, talk to us. Yeah.
Just this year alone. So we've seen, of course, the transition with the freshmen coming in. Mm-hmm. And so a lot of them have been virtual, and then you're transitioning into high school, and there are different dynamics of that. We've seen an increase in aggression, like daily, a lot of aggressive behaviors. And I've heard this across several, secondary campuses in terms of just that. I think it goes back to that whole adjustment, piece, and the numbers have increased quite a bit from last year, even the last 2 years, because we went home in 20. And then last year, half the kids were virtual, and now you have an influx of students back. And these secondary kids, they're aware of the challenges that come with the, getting COVID. So you have some who are very aware and on it as far as wearing masks and things like that, wanting to social distance. And then you have some who it's not that important to them. And you have these kids who are back to 25 kids in the classroom, and so I've seen just a lot of aggression, so to speak. And I don't know if that can be attributed to anxiety or what. I just like to attribute it to just an overall adjustment, particularly with where I'm at. I would say the freshmen coming in, just a lot of adjustment issues here.
Yeah, it's interesting you say, so if they're coming in as freshmen, especially because I have some patients that I work with and I think about that. So last time they were in school may have been towards the end of their 7th grade year. Is that right? So then they hadn't been in school since the middle of middle school, and now big high school.
Yeah.
Yeah.
And at a high school level, teachers and administrators deal with you different. They expect a lot more. It's a lot of pressures, on these kids. And so part of my role is kind of educating and helping administrators to see things from that perspective, just from that mental health perspective. Instead of just handing out harsh consequences, to understanding, hey, this may be what's going on. And like Dr. Moore said, also considering what may be going on at home in terms of a lot of assistance and those types of things that were put into place are now being taken away. For example, I had a parent there today. Her daughter got into 2 fights, never had trouble in middle school. And her comment was, I can't take off work. I can't do, X, Y, and Z. So it went back to how it's affecting at home. But of course she had to be there because, again, and it was very clear. I don't want to get into specifics of what happened, but it was very clear that her daughter was having an adjustment issue with being in high school, and dealing with lots of different variables and things like that. So.
Yeah. So just to kind of strike that difference, because I noticed that you're using the word adjustment a lot. So are you if you could make a distinction between that, so you're trying to make a distinction between just the general adjustment to a new part of life versus having maybe a big kind of clinical anxiety disorder or something like that? Is that kind of yeah.
Because a lot of times with kids or anyone, when we are dealing with adjustment issues, it may manifest itself through behavior or our emotions. And so if you know there's been a change, but you don't want to label it as a specific emotional issue such as depression or anxiety, I do like to just loosely say there is an adjustment issue going on that may be causing some behavioral issues. Not sure, it may, and there could be some other emotional depression or anxiety, but the biggest, I think it all falls under the umbrella of adjustment that's affecting that behavior.
Yeah, because it's a big change. So that's a huge situation, a huge change that people have to figure out, how do I just settle into this big change in my life? What would you all say for, go ahead, Regina.
I was just going to say, for a lot of them, particularly as Kim was saying, the students who were virtual since spring of 2020, and I think those students also missed a lot academically. And so they're coming back, maybe you were in 5th grade when you were in the pandemic, and then now you're 7th grade and you were on virtual. Virtual is a good thing, it's better than nothing, but for a lot of kids, and I talked with several parents and did interviews with a lot of people in preparation for an article I'm working on that talked about how for like some of their kids, virtual worked fine. But for kids who had any type of challenges, it was a struggle for them, and they feel like their children lost out academically. So again, it's adjusting back to that regular school setting. But like Kim said, you're at a higher level of expectation. I was in elementary school when the pandemic hit, but now I'm in middle school. I had to deal with maybe 2 or 3 teachers in elementary. Now I have to deal with 7 or 8 and all different personalities. And so it is a lot. It's a big challenge for parents to really kind of help navigate that as well, and guiding their students sometimes in what they need to do. So
yeah,
I also think that students, and I'm speaking to the secondary, like high school level, dealing with, you have teachers who are not comfortable totally being back in the full classroom, and they deal, and so students, I mean, these kids are very smart these days, and they pick up on things, sorry, somebody was calling my phone. Kids are very smart and they pick up on things. I had one student, a teacher was coughing, and she said, "You need to be sprayed with a bottle of Lysol." And she went home and told her, I, for another reason, ended up speaking with her parent. She didn't want to be in that class because the teacher was, I mean, it could have been an innocent cough, but these days you can't have no allergy, you can't have nothing without folks thinking, do you have COVID? But I think that's another, we talk about layers. I think that can add to stress on these students, they are concerned as well, some are, and that can affect them as well.
Yeah, absolutely. Absolutely. What would you all say for parents who are concerned, if they know that this is an adjustment, a huge change for their kids, their children, for them, the educators? What advice or tips would you give to parents who are trying to determine, like, is this just an adjustment that, in about a few weeks, they're going to settle in, school is starting, or do they need to be more concerned? When does it get to the point where now they really need to pursue some professional help or talk with the counselor at school? When does it get to that point?
I think one of the things that I see in elementary school is that when you have students who previously had really no behavior problems, they were not having meltdowns, they had good grades, they were like one of the ideal students. And you see their grades starting to drop. You see them being more, and I don't want to say irritable, but things that usually wouldn't affect them so much, it's affecting them now more emotionally. And I think that will warrant you just talking with a school counselor, having the parents call and say, "Hey, I'm noticing this in my child, and I'm not sure what's going on. It may just be adjustment back to school, but do you mind talking to them for a few minutes? There's no cost to the school counselor talking to them. And it also depends on the degree of the behaviors. I've seen students who, like last school year, had several students who were suicidal. Well, that's a no-brainer. We need to talk to a therapist, depending on whether they have a plan, how elaborate that plan is. You may need to call a mobile assessor, and you're all the time communicating with the parent. This is why we need to do this. This is why we're doing this. Are you on board with this? And always make sure that you're including the parent if it's the school saying we need to do these things because the behavior has gotten so far. And I use the word behavior loosely because is behavior that usually gets the attention of those that be. If it's a bullying situation, talk with your school administrators about it, and where it's happening, and encourage your child, teach your child how to be a self-advocate. Even in elementary school, they can be a self-advocate. They just have to know how to, and I find that that's one of the biggest challenges is that for kids is they don't know how, I need this right now. They don't really know how to navigate some of those systems within the school setting. So teaching the kids how to advocate for yourself. And also sometimes it's a matter of teaching parents too, or giving them tips because they get so overwhelmed. I mean, if the school has already called you 15 times and we're only 4 weeks into school, that's pretty overwhelming. And so sometimes parents just throw their hands up. Sometimes they get frustrated and angry. And so it's looking at the situation and the degree to which certain things are happening. And I think the first step would be to bring in the school counselor to talk with your student. And you talk to the school counselor as well about what your concerns are if you're a parent. And I'll let someone else.
I'd like to add that oftentimes the squeaky wheel gets the oil, right? So it's pretty clear when there are overt behaviors such as aggressive, maybe fighting, bullying, things like that. But also let's not forget the ones that may be more covert in nature. So more withdrawn. If your baby was at one point talkative, but is now more withdrawn, loses interest in the things that they once used to be interested in, appears to be sleeping a lot more than what they used to, or sleeping a lot less than what they used to, changes in maybe eating habits, hygiene changes, things like that. Those can be some indications that there may be some mood or emotional concerns that may warrant you seeking out additional supports within the school or outside of the school. Those same symptoms apply to parents too. So if you find that you're struggling a little bit too, feel free to, I'm kind of encouraged by the number of people who are now seeking mental health services. I would like to think that the stigma is slowly withering away, and that I know it's still there, it's still ever present, but I'm thinking people are now understanding the difference between selfishness and self-care. They're two completely different things, and seeking help for yourself is not being selfish. So I'm just would like to encourage parents to be on the lookout for some of those symptoms with their kiddos, but also within themselves, and seek out appropriate services as needed.
Yeah, that's great. I appreciate you offering those both of you all offering very specific signs and symptoms around changes, because you all both talked about like grades, changing in sleep, appetite in both the child and the parent, and being able to seek services, either talking to the school counselor or seeking mental health treatment from somebody outside of the school, but somebody who can be helpful and supportive in that process. We actually had a comment, and I think is a good comment, of looking at the additional additional stress that some students might feel, particularly students of color who are dealing with challenges regarding systemic racism, right? Because when we talk about like the pandemic, one of the things we've been talking about throughout this Mindful Minute conversation series is basically dual pandemics. The idea that for students of color, students within the Black community, that not only are they dealing with COVID and that pandemic, but also ongoing systemic racism in the classrooms and everything. And so that's just something just to kind of add to the conversation when we talk about compounded stress, compounded sources of anxiety, that definitely issues around race and racism is part of that. And we do have to make sure we're mindful of that when working with our children and families.
I would also add cultural sensitivity into that. Especially from administrators, when dealing with these.
Can you talk about that? Like, what do you mean cultural sensitivity? Can you elaborate?
Just understanding what happens in a particular ethnic group's culture. Certain stressors that may be prominent, with this group that you are not used to because of privilege. And so you may not understand.
Right.
Why little Takesha is acting,
Right.
and I said Takesha on purpose to,
to make
maybe acting or responding the way that she is. Or when we think about stressors that are going on outside of school, home stressors that will affect a child, in their day-to-day activities. So, because I've seen a lot, with not being culturally sensitive.
Yeah, I like that because it requires that awareness, that sensitivity, and then hopefully that responsiveness. After you have that awareness, that information, understanding that with from any perspective, you might have a bias or just a place of not knowing. And it's just like now how to be sensitive to that and responsive. Somebody did have another question, like, are you all seeing any racial tensions? An increase in that, or that playing a role in some of the dynamics with kiddos, families, children?
I think there are subtleties that I see, and it kind of goes back to what Kim was saying about cultural sensitivities. I don't even think sometimes that they are even aware of what they're doing. And I've seen situations where a student of a particular ethnic background or racial background that presents with problems, or just like some of the things we're seeing, they're either anxious, they don't know how to handle their emotions because they haven't been taught that, or in their environment, emotions are kind of scary things when they see how some people within their environment respond and act when they're angry or when they're disappointed. And so we tend to, some of the people act like, oh, well, I just don't understand why people act this way, and I don't understand this. And I would just say to them, you have never walked one step in their shoes. You've never slept one night in their bed. You don't know what's going on. And it's not, I find if you can teach, you can engage, someone needs to be willing to engage, to look beyond what's on the surface and try to get an understanding of the child and what they're feeling. Like I had a little fella who was upset because, and it was all about his teacher was out and he wasn't prepared for that. And he just, just had this big meltdown. And I was talking to him and I asked him, I was like, so what are you upset about? He wanted his teacher. He wanted the teacher that he's used to seeing every day, but he didn't know how to communicate that in words. And so you saw behavior, and vice versa. That sometimes you see the kids just really kind of shrinking away, they just kind of fade into the background of everything. But it has to do with the adults in that situation being sensitive and aware, number one, of their own biases. And a lot of times people say, well, no, I'm not biased or whatever. But if you've ever been in a disadvantaged group, you can see that. And you are pretty attuned to that sometimes. So I think that's one of the things is that they need to be aware. Administrators, teachers, the custodians, everybody in the building needs to be aware of what their own biases are towards other people and try to ensure that they're not letting that overshadow what's going on with this student and be a barrier as opposed to a support.
And also in the clinic, I can't say that increased racial tensions have been reported amongst the kids, but I see kids and adults, and certainly among the adults, and particularly in the workplace. So I'm hearing parents, and even those who aren't parents, they're dealing with a lot of issues in the workplace. So just taking it, and we don't even have enough time to really go through everything that's going on. Just if we can just, we could probably spend several hours about the workplace. But given the shortage, the employee retention issues, the shortage across a number of industries, tensions are extremely high. And I'm hearing that certain individuals may talk to in other individuals like Black folk or other minority in a way that's demeaning or anything, more so than what they used to prior to the pandemic happening or prior to things start transitioning during the pandemic. So I'm hearing a lot of things that in the workplace that may, so that's just one more thing that parents may have to deal with. Not only if they're working, they have to deal with these issues with folks talking crazy to them, and then the school calling about their baby, then the home stuff is, I mean, it's just, it's overwhelming. I'm overwhelmed just thinking about it, just talking about it. So I can only imagine.
I liken that, Dr. Moore, too. And this is not politically correct how I'm gonna say it, but it almost seems like certain groups are bucking against the whole Black Lives Matter, the whole cancel culture, that whole movement, to prove you're not special because you're in this group. Does that make sense? Because I was at a football game at another high school in a different district, and it was a teacher in the concession stand in front of me, and I heard her say, she was having a conversation, and I was ear hustling, but I heard her say, I don't think it's fair that we're doing this just because it's a Black student. I don't understand why they make everything about race. And so there are a lot of subtle things and happening in that regard. And so anyway, just to piggyback on what Dr. Moore, she said it very impactful. But you do have, certain groups bucking against that whole Black Lives Matter, that whole movement, just it's like a fight. No, you're not special. We're not going to do this just because. And it's affecting kids in education. I think from what I heard from my ear hustling, it was something about a student being moved into a different class or whatever. But I just remember her making the statement, I just don't like how they make everything about race. So.
Yeah, I appreciate you offering that example, because I think what we know, if that's what's in somebody's minds, their beliefs, their heart, their attitudes, that's gonna like seep out one way or the other, right? And like you said, these kids are smart. They can pick up on subtle things, the way somebody looks, responds, their tones, and all of that, right? And so this is, like you say, just added to the stress. I want to shift over a little bit to make sure we get in some tips and practical resources and that kind of thing. So all of you all have mentioned the compounded stressors that parents are dealing with, everything that we're talking about or what parents are dealing with day to day. We had a question, how would a parent respond if they know their child has come home and had a stressful, frustrating, just hard day? What can parents do to help their child? Like they just know this has been a tough day and their child come home crying, just looks defeated, exhausted. What can parents do?
Well, one of the things they can do before you jump into homework and all of that is to give them some time to decompress, to let them talk to you, have a conversation with them about what your day was like. Do you need us, sometimes by the end of the day, especially if you're in pre-K and kindergarten and first grade, you might get a snack in the afternoon, but if you're a higher grade than that, you're not getting a snack. So they may just be physically tired, blood sugar levels have plummeted. There are all kinds of things. So just give them some time to decompress. I know that students have homework to do, but you should not be spending the entirety of your evening working on homework, particularly if you are less than 8th grade. that's just hard. And give your children permission to be who they are. You know, just acknowledge their frustration and all of that. And, you know, have some conversations with the teacher. Parents don't realize, even if your child is not a special education student, if there are some other mitigating circumstances, maybe your child has asthma or something, you know, things, they may have diabetes or whatever, you can ask for a 504 plan through the school to help give them some additional accommodations, like extended time for assignments and things like that, that will help them. And just, you know, at home,
Can I just interject real quick? If you could just say, when you say 504 plan, people might not be aware, like what is that? Just real briefly, if you could just say what that is. Yeah.
504 plan was established at, it's a plan or a program that can provide additional accommodations for students in the classroom. Even people in the workplace can get a 504 plan if they have certain medical issues and things like that. And what it does is it provides you an opportunity to remove some of the stress. So like, I'll give an example of, if you're in a class and your teachers decided we're going to give 50 problems for you to work in a certain period of time, math problems, and your student has anxiety, or they have maybe they just fatigue easily. In a 504 situation, they will be given some extra time or extra accommodations. And so these are not really a disability or conditions that could interfere with your ability to perform as you would if you did not have these issues. It interferes with that. It doesn't meet the same litmus test as under the Individuals with Disabilities Act. It's really a rehabilitation act. And so it makes those allowances. And all too often I see parents being pushed to seek an IEP for their child when these accommodations are there, and it doesn't require them leaving the regular classroom setting. They're not losing time in the general education setting. And so that's one of those areas that they can ask for their child. And they will have to explore that with their individual school that way. But just to give them slack, some time. If you know, when we come home from work, we're all exhausted. We don't go plunge into like, okay, I'm getting into tomorrow's work, I've got to work out this plan. We give ourselves some time. We may watch a little TV, we may go walk or do some things. Give kids the permission to do the same kinds of things to decompress from their day. That's the top thing that I would say.
And then I would also add that just as Ms. Hunt said, to acknowledge, right, that they have these feelings. And then I think sometimes it helps for my daughter, my kids, it helps for me to kind of be able to relate to them and normalize those feelings and say, mom has rough day too. So even if the adults are struggling, maybe it's okay that I've had this rough day, but tomorrow's a new day. We're gonna leave today, and then we're gonna wake up with a fresh new attitude. What I have since this pandemic has hit is I've allowed my little one to have mom approved, of course, mental health days. So I take them, they're very necessary, and establishing boundaries and with other folk, your time, your energy. And so I think one of the great things that came about from this pandemic, if that's even possible, is the increased communication. And I would encourage parents to really, really just have a conversation with your kids. Let them know that you're struggling too. See, because for a long time, I thought my parents were perfect. Even though I knew they weren't, I thought that they were. And it's just something about realizing, wow, I don't have to be perfect, and my mom and dad still love me. And that's the absolute truth. So how best to model that, if not yourself, to your kids?
I think that's great. Yeah. Kim, anything else you would add about how parents can support their kids in handling just the stress and anxiety and frustration and anger? You mentioned anger and aggression. Yeah.
They pretty much covered everything I would have said.
Okay. Yeah. So I love it. So if we just like recap, it sounds like having time to decompress, letting them know time to just relax, regroup, recuperate, just having time, giving them permission to do that, having that communication with them. You all talked about mental health days. I'm sure Dr. Roy, what you mean by that? Like if they just need time, if they scheduled to go to school, but they just need some time to be home for self-care. It's not selfish, but kids need self-care too.
And that does not mean that you go kick it, go to the swimming pool in the back all day or be on roadblocks all day. No. It's nothing like that. But I just feel like sometimes kids get tired too. Kids get exhausted and overwhelmed. And this may not be appropriate for everyone, but I did what I felt was best for mine. And she needed that break, especially last year. We took advantage of those days last year. So if that time, if I feel like that time is necessary this year, then I will do so. But they're occasional mental health days. But I know some people who schedule at least once a month. So you are the experts on your children. You know your babies. So whatever you feel like they need.
Mm-hmm. Yeah. And I think that goes back to the conversation we're having about understanding them, like from an educator perspective, a parent perspective. The more I think parents and educators are trying to understand genuinely and be in tune with the child, like be connected, pay attention, then there will be a greater understanding of what they need. So I just want to just interject this other point that Regina mentioned about talking to the counselor, because it seems like what you're saying is there can be some school supports, accommodation services, something that can be offered through the school. So if there are concerns, talk to the school counselor, anybody there, just somebody, see who to talk to. But it seems like it's usually the counselors that really is a go-to person for it, and to see if the school can provide any additional support beyond what's already being done. Okay. We had this another question around actual like professional services. So if a parent realizes like, hey, this seems to be beyond what's expected, you all have said that if their grades are falling, if they're having difficulty with sleep or appetite, focus, energy, behaviors, something like that, these are red flags. So if parents are kind of saying, I'm seeing some red flags, where can they go? Where can they get these mental health services to kind of evaluate what's going on?
So if there's several options. So if you are interested in having services being offered to your child in the schools, they actually quite a few school districts have school-based mental health services. That means certain agencies are contracted with the district to provide those mental health services and even case management services to the family as needed. Little Rock School District, I know for sure has I think there's like 10 or 11 agencies that are attached to that district. I'm not for sure about Pulaski County Special School District. North Little Rock, if I'm not mistaken, also has those agencies that come into the school. They accept most agencies accept those insurances, private and state funded insurances. And so you can go from there. You can also, if you are wanting this to seek services outside of the school, you can go to clinics. There's a resource form that we're going to share with your viewers and get that to you, that lists some for adults and for kids. Most of those, what I provided, are community-based mental health centers. So those, I got some clarification from Ms. Hunt, and I don't know why I'm blanking. Give me a name, boo.
It's the Heroes Program.
Miss Kim. I couldn't think of Kim and nothing to save my life, and I talk to her quite often. But anyway, so some of those agencies, if I'm not mistaken, if you don't have insurance, they sometimes offer a sliding scale or income-based resources, if I'm not mistaken. I have linked with the woman who is phenomenal. She knows everything insurance. So individuals that come to me and they may not have insurance that we can bill for their services, I send them to her. She is able to figure out and navigate several different options to get my people insurance. So I always have a connect with that, in some kind of avenue. So I guess it's depends on if you have insurance, you have options. Even if you don't have insurance, you can get some, and then you'll have options. But substance use, we have not talked about that, but I know is prevalent. Okay, so I think it's also important to know where to go if the adults or children need substance use therapy, right? So on that resource form, I put that in there as well.
Okay,
And then
good.
at the bottom of that resource form, it helps you to figure out what your mental health services are. So you're going to call the number on the back of your insurance card, and I gave you several things to ask, so you'll know what your mental health services are if you have insurance.
Okay, thank you so much for that, Dr. Moore. That was very helpful. So just so the viewers kind of know this, we being the Arkansas Association of Black Psychology Professionals, we're going to post that on our Facebook page, these resources that Dr. Moore is referencing. And so that'll be on there. So please stay tuned, follow us on our Facebook page, because we'll put those references, which are mental health services for children, you said, for the adults, for parents, substance use, and then other services and other resources that could be helpful. That will be on our Facebook page. Please also know that as an association, we are continuing to update as we get information, a directory that includes Black mental health professionals in the state of Arkansas. So we do our best to keep that updated. We don't have everybody, but we do have quite a few. So if as a listener, you yourself, once you're thinking about services for your child or for yourself, please send us a message on Facebook and we'll do our best to get names to you. I know we are about out of time. So I'm just going to ask you all, this has been great. This has been a great conversation. I know we could probably just go on and on about this. There's so much going on, so much that we could discuss. But please, listeners, know that we are going to continue to have this conversation once a month. But before I get into what our other conversations are going to be about, I'm just going to ask each of our panelists to just close us out. If you would like, close us out with just a few statements that you want to leave our listeners with, particularly focusing on this conversation about parents navigating this very stressful time.
My go-to is always give yourself grace and give your children grace. It'll take you a long way.
I love it. Yeah, you're on mute, Regina. Go ahead.
I said instead of unmuting, I muted myself. The takeaway that I would say is to know, regardless of what your situation is, that you are a person of value. I know sometimes we don't bring religion into a lot of things or spirituality, but know that our God says that we were fearfully and wonderfully made in his image. And it doesn't matter what the problem is that we continue to look for resources and support, and that we never give up fighting for ourselves and for our children, because if we give up, they give up.
Thank you. Yeah, Dr. Moore.
One thing that came to me when you asked for us to leave everybody with something, I just want everybody to realize two things. For he has not given us the spirit of fear, but of power, love, and a sound mind. So remember that when you're going through sometimes these temporary circumstances, they are just that. They may last a little bit, but sometimes we have to be mindful to not make permanent decisions, permanent choices to temporary circumstances. Okay? So seek out folks. I know a lot of us are full book, overwhelmed too, our mental health providers, but we'll help find someone. If you're in a crisis, first of all, if it's an emergency, call 911. But if you are willing to wait a little bit, I know that some providers can get you in sooner or later, but just be patient, hang on in there. And I think now we have got to learn how to open our mouths and ask for help.
Mm-hmm.
Well, I just wanted to say that one thing I didn't say that, Dr. Moore, is that we have to realize that we need to pull back the stigma of mental health and the whole surrounding of mental illness. There are individuals in our communities, our families, our congregations who have mental health issues or mental illness. That is not a shame, it's not a disgrace, although people sometimes treat you that way. But if you want to be successful in life and provide for you and your children, you're going to have to push through that. And as Dr. Moore said, there are resources and places that you can get help. Just reach out.
Yeah, absolutely. I love it. So ask for help. Not making permanent choices based on a temporary situation, moving forward with power, love, and a sound mind that we have been given. Know your value. And as Kim said, I love it. Give yourself and your children grace. So thank you all for all of the nuggets, the information, the knowledge that you shared today. Please, everybody, know that this is going to remain on Facebook. We're going to upload it to our YouTube page as well, so people can go back and watch the replay. If this information has been helpful for you and you think it could be helpful for somebody else, please share it. Share the link if it's on YouTube. Share it if it's on Facebook, because we really want to get the information out. We are going to continue to have these conversations. For the most part, the first Monday of each month. So going into October, on October the 4th, we're going to have a conversation about resilience in the face of trauma. So today we've been talking about everybody experiencing a lot of basically adversity, trauma, and stress. So we're basically going to continue the conversation, but it's going to be a conversation about resilience. This is going to be on October the 4th. And then in November, we're going to continue the conversation as well about parents. So we're going to have somebody coming on talking about parental advocacy, how parents can advocate. And in December, on December the 6th, we're going to have a conversation about childhood depression. So please continue to join us for these conversations, as we hope that they are helpful to you and others in your community. Thank you so much again, panelists, for joining us. Thank you for your time and expertise, because I know you all have a busy schedule. So again, thank you. And thank you for your listeners for joining us here today. We'll see you next time.